Why do people snore? Snoring causes. Sleeping with restricted ventilation causes snoring. Loud or long-term snoring raises heart attack, stroke, and other health risks. Losing weight and avoiding alcohol before night may stop snoring. Talk to your doctor about snoring treatments if it wakes you or your partner. What is snoring? Airflow problems cause snoring. When air is driven into an obstructed location, soft tissues in the mouth, nose, and throat bump and vibrate. Vibrations are rattling, snorting, or growling. Snoring disrupts sleep. Chronic, loud snoring may indicate obstructive sleep apnea. Snoring can be treated with many surgical and non-surgical methods. Snoring. How common? Snoring is prevalent. Anyone can snore. It's more common in obese guys over 50. Who snores more? Babies, kids, and adults all snore occasionally. Some folks snore more. Snoring risk factors. Age. As muscular tone declines, airways narrow, causing snoring. Alcohol and sedatives. Alcohol and some drugs relax muscles, reducing airflow in the mouth, nose, and throat. Anatomy. A lengthy soft palate, the rear of the roof of the mouth, swollen adenoids, tonsils, or a large tongue can make airflow difficult. Airflow is blocked by a deviated septum. Men snore more. Snoring is inherited. Snoring is more likely if your parents do. Wellness. Allergies and colds impede nasal airflow. Hormonal changes and weight increase cause pregnant women to snore. Weight. Obesity and overweight people snore more. Why do we snore? Your nose, mouth, and throat breathe air. The soft palate, tonsils, adenoids, and tongue vibrate as air passes through a limited airway. Vibrations rattle. Many causes can obstruct airflow. For example, alcohol and other muscle relaxants limit airflow. Large adenoids, tonsils, or tongue. Excess bodily fat, which pressures the airway and soft tissues. Nose irritation from pregnancy hormones. Mouth, nose, and throat muscle weakness. Cold, flu, allergies, or airborne irritants cause nasal congestion and inflammation. Airway restricting mouth, nose, or throat structures. Snoring symptoms. Snoring sounds range from whispers to loud groaning, snorting, or rumbling. Snoring causes sleeplessness, a dry throat, and daytime fatigue. Sleep deprivation causes headaches, moodiness, and difficulties focusing. Some sleepers gasp for air and stop breathing. If untreated, sleep apnea can cause major health issues. Non-surgical snoring treatments. Your doctor may suggest posture improvement or sleep airway opening treatments. Snoring remedies. Avoiding alcohol before bed, adjusting your sleep posture, and maintaining a healthy weight can prevent snoring. Medications. Cold and allergy drugs clear nasal congestion and improve breathing. Nasal strips. Flexible bands keep nasal passageways open. Oral appliances. Sleeping with an oral device aligns your jaw for airflow. Your doctor may name it a mouthguard. Sports mouthguards won't stop snoring. Snoring surgery options. Surgery can reduce or remove extra tissue or fix structural issues to cure snoring and sleep-disturbed breathing. These techniques are minimally invasive. Small incisions allow you to go home the same day. How to stop snoring. Lifestyle, food, and activity changes may reduce snoring. Ask your doctor about nasal congestion treatments. Avoid alcohol and sedatives before bed. Keep a healthy weight and exercise regularly. Raising the bed's head improves airflow. Sleep sideways. Try a snore-reducing pillow that aligns your head and neck. Snoring's prognosis. Cold and flu-related snoring is harmless. Sleep apnea, a dangerous disorder, can be caused by loud or frequent snoring. Long-term snoring increases health risks, including oxygen deficiency, concentration issues, fatigue, cardiac arrest, BP, stroke, and diabetes too. Should I visit my doctor regarding snoring? Health issues might result from snoring. Talk to your doctor about snoring prevention. If you can't breathe at night or are exhausted during the day, consult your doctor immediately. Talk to your child's doctor about snoring. Snoring children may not sleep well. Kids' behavior problems grow with sleep deprivation. Kids who don't get enough sleep are more likely to be fatigued and have problems focusing at school. Please like these fascinating snoring facts. Subscribe and hit the bell to receive weekly video updates.